All right, so you've sent over some research on oral health. And to be honest with you, it's really got me thinking. I have to admit, I wasn't really prepared for just how important all of this is, particularly when we start thinking about aging populations and dementia.
Yeah, it's definitely an area that I think needs a lot more attention.
Yeah.
Most people don't realize how interconnected oral health is with just overall well-being, especially when we're talking about seniors and people with dementia.
Yeah, and it's interesting because we're living longer, which is fantastic, but it also brings up new challenges, right? Like one of the stats that really jumped out at me was that by the year 2100, over 3 billion people globally will be over the age of 65.
Wow. Yeah, that's incredible. And you know what's even more? The fastest growing segment of that population are people 80 and older. So that group is projected to actually quadruple in just the next 40 years.
That is a lot of people.
Hmm.
And, it's not just about dentures anymore, right? Like we're keeping our teeth longer, which is great in theory, but it presents a whole other set of issues.
Exactly. You're right on. It's not like our grandparents' generation. People are keeping their teeth for longer, which is fantastic.
Mhm.
But with that comes an increase in age-related oral health issues that we need to be prepared for. And a lot of those needs, unfortunately, go unmet. And particularly when you add in the complexities of dementia, that's when things get really tricky.
So let's talk about dementia specifically then. You mentioned kind of adds another layer to this whole thing. What does that actually look like in terms of oral health?
Well, just imagine for a second, even basic hygiene like brushing your teeth, it becomes incredibly difficult if you're dealing with cognitive decline. And you add to that the fact that a lot of people with dementia struggle to communicate their discomfort or pain. So issues in their mouth, often they might not get addressed until they become really quite severe.
And that's where this Chalmers and Pearson research comes in, right?
Hmm.
I know we talked about this a bit beforehand, but their work from the early 2000s really seems to be a cornerstone for understanding how dementia can impact oral health.
Oh, absolutely. Their research was so important because it focused specifically on people with dementia living in residential care settings. And what they found was honestly pretty eye-opening.
Okay, so let's get into it. What did Chalmers and Pearson actually discover? How does dementia actually change things when it comes to oral health?
One of the most striking things that they found was how much more common certain oral health problems were in people with dementia. Things like plaque and calculus buildup were significantly higher. The rate of gum disease was much higher, and a substantial number of these individuals had cavities.
Not just cavities, right? We were talking about this before, but they identified something called root caries as
Mhm.
being much more common in this population as well. Can you tell me what those are exactly? I have to admit I wasn't familiar with that term.
Yeah, it's not something that most people really think about until it happens to them.
Right.
Essentially, root caries are cavities, but they form on the exposed roots of your teeth, which becomes a bigger issue as we get older and our gums naturally recede. And so if someone's having trouble brushing their teeth properly because of dementia, those exposed roots become really vulnerable.
That makes a lot of sense. So you're saying that because of these difficulties with hygiene, people with dementia might be more likely to develop these types of cavities.
Exactly. And in fact, what Chalmers and Pearson found was that on average, individuals with dementia had 3 times as many cavities on the chewing surfaces of their teeth compared to seniors without dementia. And then you layer on the fact that they're also more prone to these root caries because of the difficulties with taking care of their teeth. It just creates a really challenging situation.
Wow, 3 times as many. That's a really stark difference. It really highlights how significant of an impact dementia can have on oral health. Was there anything else that stood out to you from their findings?
There's one other thing. It's kind of a surprising finding at first, but as dementia progresses, people actually use their dentures less.
Really? That is kind of surprising. You would think that dentures would be helpful for people who are having trouble brushing. Why would that be?
It does seem counterintuitive, right? But when you think about the challenges that someone with dementia might be facing, it starts to make a little more sense. They might forget that they even have dentures or where they put them. They might forget how to actually put them in, or sometimes they even find them uncomfortable, but they can't really communicate why. And we can't forget about the caregivers either. Sometimes caregivers struggle with making sure the dentures are cleaned and cared for properly. So that adds a whole other layer of difficulty.
It's like this domino effect almost. Dementia progresses, oral hygiene becomes more difficult, and then dentures, which are supposed to be a solution in some ways, just become a whole other thing to manage.
Yeah, unfortunately, that is often the case. And I think it highlights how important it is to understand that oral health issues in people with dementia, they're not static. So in the early stages of dementia, someone's oral health might be fairly similar to their peers who don't have dementia. But as the disease progresses to those moderate and severe stages, we see the problems really start to escalate quite rapidly.
It really underscores how important it is to try to address this early on.
And it's not just about what's happening in their mouth either. It's easy to think about oral health as the separate thing from overall well-being. But Chalmers and Pearson,
Mhm.
they found some pretty strong connections there.
Yeah, that actually reminds me, I wanted to ask you about that. What is the connection between oral health and someone's overall health? Especially when we're talking about people living with dementia.
Well, for one thing, let's think about eating for a second. Imagine trying to eat if your mouth hurts, or if your dentures don't fit right. It's not just uncomfortable. For someone with dementia who might already have a smaller appetite or forget to eat sometimes, that can lead to malnutrition, weight loss, weakness. It can really have a big impact.
And it's not even just the physical stuff, is it? I have to imagine that having these oral health problems could make it even more difficult to communicate.
Oh, absolutely.
Yeah.
If you've got a toothache, if your gums are sore, if your dentures are rubbing, it's hard to talk. It's hard to express yourself. And for someone with dementia who might already be struggling to find the right words, that can be incredibly isolating. They might start to withdraw from conversations, not want to participate in activities that they used to enjoy.
It's like a vicious cycle almost, isn't it? Dementia makes these oral health problems more likely, which then isolates the person even more. Maybe even makes the cognitive decline worse.
It's definitely this really complex interplay of factors, and it goes even deeper than that. We've been talking about what's happening in the mouth. But poor oral hygiene, especially when it leads to gum disease, can actually increase the risk of some pretty serious health problems.
Like that aspiration pneumonia you mentioned earlier. That's a pretty scary thought.
It can be very dangerous, especially for older adults who might already have weaker immune systems. Essentially what happens is when you have poor oral hygiene, bacteria build up in the mouth, and if that bacteria gets into the lungs, it can cause a serious infection like aspiration pneumonia.
Wow. Okay, so it's not just a toothache we're talking about here. It can actually escalate to something life-threatening.
Exactly. And then there's another aspect to all of this that's only recently starting to get the attention it really deserves, and that's the link between gum disease and systemic inflammation.
Yeah, I've heard a little bit about that. Is that this idea that inflammation in your mouth can actually impact other parts of your body? Like I've heard it's connected to heart disease and diabetes, even Alzheimer's.
That's the idea in a nutshell. Now, more research is definitely needed to fully understand all the mechanisms at play. But the current thinking is that if you have chronic gum inflammation and it's not treated, it can actually contribute to inflammation throughout the body. And we know that inflammation is a key factor in a lot of chronic diseases.
It's like that domino effect again. But on an even bigger scale, it's not just your mouth. It's your heart, your brain, your whole body that can be affected.
Precisely. And that's a huge part of what makes this whole topic so important, especially when we're talking about a population that's as vulnerable as people with dementia. It's about recognizing oral health as this crucial part of overall health and well-being, not just an afterthought.
It's about seeing the whole picture.
Right.
And that kind of brings us to, I think, another really important piece of this whole puzzle. And that's the caregivers.
Mm.
I can only imagine how challenging it must be to provide daily oral care for someone with dementia.
It is incredibly demanding, both physically and emotionally. You have to remember, we're talking about people who might not understand what you're doing, who might be frightened, agitated, resistant, and physically they might have limitations that make it really difficult to help them.
It's a lot to ask of anyone, especially to do day after day. What kind of specific challenges do caregivers face when we're talking about oral care?
Well, on a very practical level, time is huge. Caregivers are often incredibly stretched thin trying to meet so many needs, and they might not actually have the training or the knowledge to feel confident providing oral care for someone with dementia.
That makes sense. It's
Yeah.
not like they teach you this stuff in school. How to help someone who has these cognitive challenges brush their teeth or care for their dentures.
Exactly. And often there's a real lack of standardized protocols for oral care in dementia patients. So that means the care that they receive can be really inconsistent, and opportunities for prevention might be totally missed.
So it's not even necessarily about individual caregivers not trying hard enough. There are some systemic issues at play here, too.
Absolutely. And honestly, even with the best training and support, it can still be so emotionally difficult. Caregivers might feel fear aversion, even the sense of helplessness when they're faced with these behavioral challenges that we often see with dementia. It's very easy to get frustrated when someone doesn't understand why you're trying to help them or when they're resisting your efforts.
It's such a heavy load to carry,
Uh-huh.
and it makes you realize we need to be doing a much better job at supporting these caregivers, both
Yeah.
professionally and emotionally.
100%. We need to equip them with the right tools,
Hmm.
the right training, and the right support systems to be able to handle these very real challenges.
It's interesting. As we've been talking about all of this, it makes me wonder because a lot of the research that we're discussing, like the Chalmers and Pearson study, it seems to really focus on dementia care that's provided in these residential settings. But what about the folks who are living at home, the ones who are being cared for by family members?
That is such a good point. You're absolutely right. A large majority of the research out there really does center around residential care, but the reality is that there are millions of people with dementia who are being cared for at home by their family members, and often they're shouldering this immense responsibility with far fewer resources and support than you would find in a professional setting.
It's like we almost forget about this whole other world of caregiving that's happening in homes every single day. You have families who are trying to navigate all of these challenges,
Ugh.
often feeling very alone and unequipped to handle it all.
Exactly. And the challenges can be really overwhelming.
Yeah.
Imagine for a second you're trying to care for a loved one at home who has dementia. You're already dealing with the emotional and cognitive changes.
Hmm.
And then on top of that, you're adding these very real oral health needs. How do you even begin to help someone brush their teeth when they don't understand what you're doing?
Yeah.
How do you handle denture care when they're resistant or they forget that they even have dentures? It's a lot.
It's incredibly overwhelming.
Hmm.
And, you want to do the right thing. But knowing what the right thing is and then actually having the resources to do it, those are two very different things.
I couldn't agree more. And that's where I think we need a major shift in how we approach dementia care as a whole. It can't just be about managing the disease in a vacuum. We have to start supporting the entire caregiving ecosystem. And that includes those families who are providing care in the home.
So what does that actually look like? What kind of support do we need to be pushing for? What do we need to be advocating for?
Well, I think it has to be multifaceted. So on a very practical level, we need to make sure that families have access to clear, easy to understand information about oral health and dementia. And that might be pamphlets, websites, videos, workshops, whatever works best for them. We need to meet people where they're at.
Right, because not everyone's going to sit down and read a journal article.
Right.
But something as simple as a video tutorial on how to provide denture care could make all the difference in the world.
100%. And then we also need more training programs, specifically designed for family caregivers, not just to teach them the hands-on skills, but also the communication strategies, because that's so crucial when you're working with someone who has dementia.
And it's not even just the practical stuff either. It's the emotional support too.
Yeah.
Caregiving, especially for someone with dementia, it can be so isolating.
It absolutely can be. So families need access to respite care options
Right.
so that they can take a break, recharge, avoid burnout, and they need support groups. They need spaces where they can connect with other people who truly understand what they're going through.
It's about creating a community so that no one feels like they are facing these challenges completely on their own.
Hmm.
It makes me think back to something we were talking about earlier about how we can change the conversation around oral health as a whole. It's very easy to dismiss it as kind of a secondary concern. But doing this deep dive has really underscored for me how essential it is to a person's overall well-being.
It's not just about having a nice smile. It's about dignity. It's about comfort. It's about connection. And for
Mhm.
people with dementia, maintaining that oral health, it's a way of maintaining a part of themselves, a part of their independence, for as long as possible.
That's such a powerful way to put it. And it makes me think, if we can shift our thinking, from this idea of managing decline to how can we preserve dignity, it changes everything. It changes how we approach care, how we design resources, how we support families. It's a totally different way of looking at it.
I completely agree. It's about recognizing the humanity in every stage of life and understanding that something as fundamental as taking care of someone's mouth, it can make a world of difference.
This whole deep dive has been incredibly eye-opening, to be completely honest with you. I don't think I realized how much there was to unpack here when we first started talking.
Well, I think it's a testament to how important this topic is, and it deserves so much more attention, so much more research, and definitely more open dialogue. The more we talk about it, the more we raise awareness, the better equipped we'll be to support people who are living with dementia and the people who care for them.
Well said. And to everyone who's listening, I hope that this has been a good starting point for your own exploration. Keep learning. Keep asking those questions. And never underestimate the power that you have to make a difference in the lives of those who are touched by dementia. Even the smallest acts of kindness and advocacy can have a ripple effect.
Couldn't have said it better myself. Until next time, everyone, keep those minds curious and never stop diving deep.